Welcome to another episode of the Wealthy Podcast. I'm your host, Shauna Nairos, and today I could not be more excited about our guest. It's Dr. Grant Pagdin, who has pretty much done everything from being a flight surgeon on an F-18 squadron. He's worked in family practice, he has worked in the ER, and now he is specializing in anti-aging medicine and more specifically, and what we're going to talk about today, men's health and men's hormone health. This is a fascinating conversation. If you are a man, or if you love a man, or you are raising a young man, this is a conversation you're not going to want to miss. Listen up. The topic of today's episode is one that honestly doesn't get talked about enough. And I'm grateful to be having it because it impacts some of the most important people in my life and probably yours. We're diving into men's health and specifically men's hormone health, a topic that's long been surrounded by stigma, silence, and outdated ideas about masculinity. Research shows that testosterone levels in young and midlife men are dropping significantly, and it's showing up in ways that impact everything from energy and focus to mood, motivation, libido, and long-term well-being. And while perimenopause, women's midlife hormonal transition, is finally having its cultural moment, and we love to see it, we rarely talk about what happens when men's hormones start to shift too, because midlife men experiencing symptoms of hormonal decline also have options, which is why I'm so thrilled to be joined today by Dr. Grant Pagdin, a pioneer in men's hormone health, regenerative medicine, and evidence-based aging in our region, foremost authority on this subject. With over 2 decades of clinical experience, Dr. Pagdin has helped thousands of men navigate hormone imbalance and take back control of their health. His work bridges conventional and functional medicine in a way that empowers, not pathologizes, men at every stage of life. This conversation is for anyone who loves a man, which I don't think there's anybody that doesn't love a man, right? Is raising a man, or is a man who's ever felt like something was off and didn't know how to talk about it. Welcome, Dr. Pagdin.
Thanks very much, Shauna. It's wonderful to be here.
It's so great to have you. Can I call you Grant?
Absolutely.
Okay. I am, like I said before we started recording, I am so excited to talk to you today. You are the man when it comes to men's hormone health in our region. And you are doing incredibly interesting work when it comes to longevity medicine. So I can't wait to talk to you about that as well. But before we get into that, we have a bit of an opening tradition on the podcast. I am curious, tell me how you got here. Like, everybody that sits in that chair shares one thing in common, and that is a passion or a commitment to having an impact in some way on health. So where did that come from for you? Where did that start? And how did you get here?
That's a great opening question. I appreciate that. When I was going through high school, I would have relatives would ask me, "What's your favorite subject?" And I would say, I like them all. I like everything, just intellectual curiosity. Then when I got into university, I sort of gravitated more towards the sciences. I ended up doing a double honors in biology and chemistry and sort of, for trying to figure out, well, where's that going to lead? It wasn't that I'd always had a passion for medicine, and there was no doctors in my family. I was the first. But I kind of thought, there's a real challenge, a way to make a difference in the world, and use my sort of scientific curiosity in a field where you could never know it all, and so I guess it was sort of the intellectual curiosity that led me into medicine. So I thought, well, what do I have to lose by applying? And if I get in, that's where I'm meant to be. And if I don't get in, well, I'll figure out something else to do. So I applied, and sure enough, I got in, and that's how my career path got started in medicine. So, and it's been a very exciting journey. It's taken lots of different twists and turns, but here I am today, focused on aging optimally and on some of the regenerative strategies that we can do to help that. So it's been an exciting career. I started in family medicine, so I'm board certified in family practice. I did the fellowship in family practice, focused in emergency medicine for a number of years, and then kind of transitioned out of that sort of traditional model into, now just doing consulting and working sort of outside the sort of health insurance plan, not focused on disease management, but more focused on wellness medicine.
I love that. And it's certainly one of the pillars for us on the Wealthy podcast is not only to sort of pull back the curtain on what's happening, perhaps maybe in acute care, or reactive healthcare, sometimes called sick care, but also like in the health promotion and prevention area. And that's why I think your work is so interesting, because you do have this background coming from, I don't know, for lack of a better word, like traditional medicine, Western medicine, which is definitely more sort of post, like, now I'm experiencing symptoms, help me feel better. Whereas your approach certainly addresses that, but also there's this preventative, or like how to promote optimal health component to your work. Super
So those
exciting.
are the aspects that, the insured portion of healthcare doesn't really have the time or energy to focus on. It's not that our typical family doctors don't know about prevention. They just don't have time to really deal with it, right? So they're focused on trying to address an illness or a disease when it comes up. Whereas we can take the time to really sort of dig a little deeper and, focus more on the preventative aspects. So the services that we provide, the clients pay a private fee for that extra time and attention. But, many people will say at the end of an interview, gee, I've never had half an hour of undivided attention with a doctor before,
Totally.
So it's really, an idea whose time has come, right?
Absolutely. And I think that we have spent a fair bit of time on this podcast just unpacking kind of like the difference between the healthcare that's practiced in the hospital per se, or in family medicine, and some of the opportunities that are now emerging that are sort of on the outside of that system, but that are so empowering for people. And I think that's what a lot of people are looking for these days. It's like, I don't want to just wait until I get sick anymore. And there's a lot of things I could say about the challenges with social media and all of that distraction. But one of the great things about it is that it's starting to uncover all of these opportunities, these conversations that we can have about optimizing our health and optimizing how we age, which is where I'm going to start with you. I think this is just such a great opportunity to have that conversation. So your research and your clinical practice focuses heavily on preventative and anti-aging medicine. So how do you define anti-aging in a medical and not cosmetic? Because there's also that whole industry that's just exploding right now, but what you're doing is different.
Right. So of course, it's nice to look great on the outside, but what really we're focused on what's going on the inside. So we want to make sure that your metabolic and your hormone health is optimal. So it's not that we're against aging. Anti-aging sounds kind of like a negative thing, but really we're all about optimal aging. So keeping that sort of youthful energy, that vigor, trying to keep you disease-free and pain-free, those are really our focus. So we do a little bit of cosmetic stuff, but that's not really the forte, right? So really what we're focused on is wellness from the inside, and trying to maintain that wellness and to be as active, productive, and vigorous as you possibly can for as long as you possibly can. So we know that everyone eventually dies, but the idea is not to sort of dwindle off and become weaker and slower and more frail as you age. We want to age optimally so that we can just kind of drop off a cliff on it when our day is done.
Right. Yeah. Just gently pass in our sleep.
Right. Exactly.
I would love that.
Yeah.
And I'm glad that you've defined that because there's so many different aspects to healthy aging. We've got like physical, mental, emotional, like all of those things.
Right.
And you're right. It's so much more than simply cosmetic. So your specialty I don't know. I mean, it's probably not a specialty. It just happens to be what your clinic focuses on, is predominantly men's health. And as we record, it is Men's Health Month. So I'm so excited to have you just for that reason as well. Such good alignment there. Why do you believe men's health, and particularly men's hormone health, needs more attention, particularly within the context that you've just talked about healthy aging?
Yeah. When I first started putting a toe into these waters, it was to address women's hormones at menopause. And that was kind of the obvious place to start. And the reason it's a little different for women is that when the ovaries decide to pack it in, that's a relatively sudden transition. So those changes are pretty dramatic. Women are having hot flashes and night sweats and feeling like they're losing their mind.
Yeah, like the symptoms are
the
quite...
symptoms are really quite dramatic. And
Yeah.
so they come to us feeling that things are completely unraveling. And so if we can intervene there with women's hormones, it right away makes a dramatic shift, and they're very, very appreciative. Nowadays, my practice is at least 60% men's hormones. And the interesting thing about men is that their hormones decline much more gradually.
Mhm.
So it kind of sneaks up on them. Because it's less dramatic, I think that's often the reason why they're sort of late in coming to us and seeking treatment.
Mhm.
But the changes are a little bit more subtle, and so I think that's maybe a little bit of the challenge for men.
Yeah, and I mean, having lived with a man that is midlife, right, I would agree. Like, I think it is definitely, like, it just sort of creeps in. And then because it's so slow, I don't know if men necessarily recognize that it's like happening until one day they're just like,
Something's
I
not
don't
right.
feel like this isn't really normal. Looking back at old pictures, you just be like, wow, I felt a
happened?
whole lot different back then. And that was
Right.
only 5 years ago or 10 years ago or what have you. And I know we're going to get into this a little bit more, but there's still quite a bit of stigma, I think, for men to talk about some of these impacts that the hormonal shifts can have. So I'm going to ask you, like, what are some of you probably hear it all. What are some of the most common misconceptions you hear about men's hormones, especially testosterone, which is sort of like the topic
big
du
sort of
jour?
stigma. Exactly.
Yeah.
And so people have the impression that, gee, it's only for the bodybuilders, or
Yeah.
it's only available in the black market, and they see these guys, that are just
Jacked
super
up.
jacked, and they think, okay, well, that's not good for you. How could that be good? Right. And the other thing is that, we've heard about some of the risks associated with testosterone. And I think, in a lot of instances, those are overblown or they're misconstrued. So just kind of getting a realistic perspective on it, I think, is important. And knowing sort of, what the target level is, and it's not, supra physiologic levels. It's just kind of trying to restore things back to the optimal levels of the way things were maybe 10 or 15 years ago.
Mm-hmm. So, okay, this question was not on the list, but I'm just so curious because I grew up in that generation where it was testosterone was like for the bodybuilders,
Mhm.
and
Mhm.
it was sort of like tied up in these conversations about steroids. And I have a son who plays sports at a high level. And so, like, what's the difference between, say, like the dosage maybe, or like what you would be looking at for a man in, let's say, midlife
Mhm.
to
Mhm.
treat some of these hormonal symptoms that we talked about? We could talk a little bit more about what they may be experiencing. Like, what would be the difference as opposed to like what we're talking about, like in the olden days, like,
Right. The anabolics.
Yeah, exactly.
Yeah. So the difference is we really focus on what's called bioidentical hormone replacement, right? And a lot of people don't understand exactly what the nuance is. Bioidentical is simple. It just means identical to life. Bio is life. So we use the exact hormone that your body would be producing. And if we do that in a safe amount, we're going to do that safely. The problem comes with these synthetic anabolics. Those are mimics of testosterone or various other hormones. And the problem with a mimic is it's not going to exactly do the same function. It's going to come with a cost. And that cost is it's going to do some other metabolic derangements or something different, some unwanted effects because the molecule is not identical to the one we're trying to replace. So if we do it in a bioidentical fashion, we could do it very, very safely. And then it's also easy to monitor. If I'm giving somebody testosterone, I can check their testosterone level, right? So I can actually measure what I'm doing.
Right. And you also can start with a baseline, like you're
Absolutely.
here.
Yeah, this is where we want you to go.
Get you there.
Yeah. And everybody's a little different in terms of just exactly what it takes to get to the target.
Yeah.
So it's never just a cookie cutter approach. You know, it's always customized to the individual. And we have a few different approaches that we can take depending on the person's age or how much support they need.
Totally. Super, super interesting. So first thing first, what is andropause?
Yeah, good question.
I didn't know that this was a word
It's
until I was doing research for this.
So you might be interested to know, Shauna, there's actually several pauses of life. Menopause, of course, you're familiar with.
Yeah.
What about thyropause?
Nope, didn't know that one
Thyroid,
either.
right?
Oh.
What about adrenopause?
Yeah, no.
Your adrenals.
Is that like a time? Like I always think of, well, now I've learned menopause is like one day, but perimenopause is
It
like
could be 10 years,
yes,
right? Yes,
right.
exactly.
Do you have like periandropause?
Well, not exactly.
Okay.
Because it's a very slow decline, right? So by the time somebody is complaining of andropausal symptoms, they've probably been in it for a while, but there's no sort of tipping point where you know that you're on that slide until you kind of, like you said, wake up one morning and go, gee, I don't feel like I used to.
Right.
So andropause is a decline in male hormones, right? So a decline in testosterone production, which is an inevitable thing as we age. But it happens to different people at different times of their life. I've plenty of patients right now, they're in their mid to late 60s, maintaining a fantastic level of testosterone, haven't needed an ounce of support. And they're just doing great, right? And I have other guys in their 30s and 40s, their testosterone is, it's 25th percentile, right? And they feel like crap. So it's quite variable in terms of how it presents and what age it presents. There's no sort of magic age, right?
Yeah. And I want to ask you about some of these trends that we're seeing in dropping levels of testosterone. But first, before we go there, if a man is experiencing a drop in testosterone, even though gradual and over time, what are some of the symptoms that might be a sort of flag for that?
Right. The obvious one is lack of libido and lack of erection performance, but that's not always how they present.
Right.
Oftentimes they just present with a little bit of fatigue, kind of a lack of motivation, not exactly depressed, but just kind of not really excited about life, maybe not sleeping great, losing a bit of muscle mass and stamina, putting on a little bit of belly fat, maybe even a little bit of breast tissue, and just kind of not feeling great. And so those are the symptoms that I think kind of are a bit confusing to men because they're kind of not really sure, like, what is that all about? Right?
And much like women too, I think when men are in midlife, it's just a really exhausting time, right? Like you're raising kids and for a lot of men and women too, like sometimes you're balancing that with work and like other commitments. So you might just sort of chalk it up to like,
just life,
just
right?
life.
Just life, just stress. Yeah.
But it's not normal.
Yeah.
Right. And I think that's the thing that women are starting to get better at talking about is like, it's actually not normal to have that level of loss of libido, even if you are tired, right? Or raising kids and all of that, right? Like you don't have to live like that kind of thing. But for men, again, the stigma associated with, having those kinds of conversation or even admitting like, I just, not feeling like getting it on tonight, like that's counter.
Not very good about going to the doctor to actually talk about that, right?
Exactly.
It's just,
and
personal.
The popular narrative is, like, let's go for the guys, right? So at least that seems to be my impression of it. Right. So I do, this is a fun conversation, so fun for me.
Absolutely.
I want to ask you though, because I've been hearing more about this. This has become a real topic du jour on the podcast I listen to, and that is the dropping levels of testosterone, just sort of on a population level. And you referenced the fact that there's a lot of individuality there. So like you have 60-year-old patients that are just killing it, right? And then you have like, I've heard of male athletes, for example, in their like late teens, early 20s, where there is this like testosterone depletion. What's going on?
So one of the things is that nowadays we're exposed to a lot more environmental estrogen-like substances. These are called xenoestrogens. And they interfere with your hormone cascade, and they'll interfere with testosterone in young men. And these substances are present all around us. They're in water, food, soil, plastics, pesticides, various consumer goods. So you wouldn't even know.
Mm-hmm.
But there's way more of these now in our environment than there ever used to be in previous generations.
Mm-hmm.
And so this is going to interfere with your ability to make testosterone and your ability to metabolize testosterone.
Mm-hmm.
Yeah. So it's interesting, they've changed the range of normal. The range of normal always used to be 8 to 28 in your typical lab in British Columbia.
Okay.
They moved the goalposts. So now they tell us it's normal between 5 and 26 because, over the last few decades, average testosterone levels have been getting lower. So they just say that that's what's normal, right? Hey, could you imagine having a testosterone of 5 and being in your 40s? Like, that's not normal.
I don't know. What would that be like? Not bad.
But the person would go to their family doctor, get a blood test. Their level is 6.5 on a scale of 5 to 26. And the family doc says, well, guess what? Your testosterone's fine. It's in the normal range. But that used to be well below the normal range 10 years ago. But it's accepted as being normal now.
What's your optimal, as a doctor treating patients that are experiencing this, like when you get their labs back and you take a look and you're like, you're 6.5, like is there like, for you to feel good, I want you to be here.
Right. Yeah.
What is that?
So I'll tell you what I do in my personal life, Shauna, and I don't tell my patients to do anything that I'm not prepared to do. Right.
Yeah.
I started replacing my testosterone in my 50s, and the type of testosterone that I use is a lotion. So it's a liquid. I rub it on my skin each day, and I keep my level at 28.
Okay.
Because the normal range used to be 8 to 28. I don't want to be anything less than optimal.
Right.
But I don't have to have a level of 50.
Right.
So I just try to keep myself at the top end of the physiologic range for optimum performance.
And do you find with your are you paying attention over there, Jason?
So he goes have a bath in it.
Right.
Yeah, exactly. That's right, yeah.
People are going to be calling, I need some of that cream. So it doesn't just have to be an injectable. There are options.
Right, exactly. So
the
the two options really for replacing testosterone is you either put it on the skin or you inject it. Okay, we don't like people taking it by mouth. There are some oral versions of it, but the problem with that is it's got to be processed through your liver, and it's a bit hard on the liver.
Right.
So to avoid any liver toxicity, either put it on the skin or do an injection.
Okay.
And some people just aren't keen on doing needles, and poking themselves. You couldn't pay them to do that, right? And so it's nice to have a transdermal option. Can be made either as a cream or as a lotion, and most people will respond well to that and absorb it reasonably well. Mm-hmm. Occasionally, we'll have a treatment failure with the transdermals, and we have to transition over to injection. So we teach guys how to do just a little subcutaneous injection, with a little insulin needle, so it's not a great big harpoon in your thigh. Mm-hmm. So just a little tiny insulin needle under the skin.
And what can let's say a man midlife has been experiencing those symptoms, loss of libido, low energy, crappy sleep, loss of lean muscle mass, more belly fat. What would you say is a reasonable expectation for what happens once a man starts TRT?
Mm-hmm. So there's a gradual onset of benefits. It's not like flipping a switch,
right?
So you'll need to have this in your system for some weeks to be able to perceive some benefits. Mm-hmm. But things like erection performance and sex drive would start to come online within just a couple of weeks. Mm-hmm. Yeah. So
amazing.
It doesn't take too long to get sort of up into the upper end of the physiologic range with replacement, either transdermal or injectable. I would say, within a few weeks, we're starting to hit our target.
But that's not the only benefit, right? I mean, Okay. I'm not a man, but I'm sure that is a benefit for a lot of men. But there's also cognitive benefits.
Right. It's just that sense of well-being, right?
Yeah.
And feeling positive about your life and feeling like you have a little bit of mojo, you have a little bit of confidence, right? So those things are very closely tied to testosterone. And so, those are often the things that guys find most surprising, because they kind of didn't really realize how down in the dumps they were feeling until they get
Or just
their
like
testosterone
kind of
level.
meh. Like just
you don't feel really manly, or you just don't feel like you're on top of your game.
yeah.
So it gives men that back, which is really quite exciting.
Super empowering.
Absolutely,
I would think,
Yeah.
I know a few men in my life that have had incredibly life-changing results on TRT, and I think it's something that we need to start talking more about, because as we sort of talked about in the intro, there's still this stigma. Like, women are just like shouting from the rooftops right now, like, yes, HRT, it's so amazing, like it's changed my life. Whereas men are just like, we don't talk about that. Even ones that are embracing, the treatment plan are still sort of like, we don't talk about that. Like, why? What is that?
I think it's partly because there's a reluctance on the part of the family doctors to really embrace testosterone replacement, right? And there's a lot of worry about potential risks, and so we don't want to do anything risky, and so let's avoid even kind of going down that pathway. So if a guy would have the courage to bring it up with their family doc, and the discussion gets shut down, well, then that's the end of the discussion, right?
Right.
So nowadays you're seeing a lot more stuff coming out on social media, the sort of the bro podcasts, right? Like
totally.
the guys that are sort of like in the industry, but they're not medical.
Yes.
And they're sort of promoting hormones, promoting peptides, and this kind of stuff. So it's starting to come a little bit more into the popular conversation. It's just that I think men need to have a reliable place to go for good medical advice, because I don't think you should be doing this unsupervised.
Yes.
I think really you want to engage with a medical provider that's got some knowledge in the field, that's prepared to monitor your progress, make adjustments, measure the levels. If you can't, you can't really adjust what you can't measure, right? So, be appropriately medically monitored. But it's tricky, right? Because guys have a hard time finding, an expert source. So I have patients from all across Canada. I have people all the way out to Nova Scotia that I manage by telemedicine.
Wow.
And it's a very a field that's very much in demand, right?
I would agree. I'm going to ask, okay, so part of the stigma, I think, is that there's this perception that it's cheating. Have you heard this?
Well, certainly in terms of...
Because it does have an impact.
Well, competitive sports, like it's banned by World Anti-Doping. You can't be taking testosterone except if you have a therapeutic use exemption. So if there's a reason why your testicles are not producing, maybe you had mumps as a child, or you had some testicular injury or something, if you aren't able to make any, you can get a therapeutic use exemption for competitive sports with appropriate medical certification.
Sure.
Right.
Yeah.
So even in that arena, it's not absolutely banned.
Right.
But there's no question it is performance enhancing, right? So people that want to boost their anabolic potential, build more muscle, be stronger, faster,
leaner, even
leaner. Yeah, exactly. Well, it is something that can be prone to abuse. Right. So especially because it's available in the black market.
Right. Yeah. And I think that is part of what I'm hoping, like, we can, with this conversation, deconstruct a little bit, because this isn't about it. It shouldn't necessarily be just about performance enhancement anymore, or even just physique.
Right.
Those are great benefits to it. But what I'm hearing from you is it's actually about optimizing your health.
Right. It's about
Can
wellness.
You say,
it's about being well as a person, right? And so, when we do an assessment, we look at a whole variety of hormones. We don't look only at testosterone. We're looking at adrenal performance, thyroid performance, pituitary performance, and so on. And there's kind of a harmony of a bunch of different hormones going on. Plus, there may very well be a need for some health supplements. Maybe we want to tweak certain things nutritionally to optimize performance. So we don't have such a narrow view that testosterone is kind of the answer to everything, right? But it's forms part of a kind of an overall health plan that's a little bit more holistic, right? So we bring a number of avenues all into the treatment plan.
Yeah, and I look at it similarly to how HRT for many women actually can really add to their health profile. For example, on the bone density side of things, like replacing that estrogen can be really important as we age. And I imagine for men, in the same way that we're all sort of trying to preserve our lean muscle mass, this is a hugely beneficial adaptation, let's say.
Sure. Yeah.
And not something that's like necessarily cheating.
Right. No, here's the thing, Shauna. Nothing good is happening in your body as your hormones decline.
Yeah.
You're going to get slower, fatter, weaker, sicker, and stupider. Okay. Who wants that?
Well, there's a marketing tagline.
Exactly. Like, so who wants that, right?
No.
Do you want to get frail as you age? No, you want to preserve your bone density. You want to preserve your muscle mass. Okay, well, let's optimize your hormones, right? That's how you're going to do it. I mean, you can go to the gym all you want, but if your body's working against you and the hormones are on the dwindles, you're fighting a losing battle, right?
Yeah. So. Yeah, totally. And you're going to have to work twice as hard to get not even potentially the same results. Right. And like when we talk about building lean muscle, it's not it works from the aesthetic lens for sure, but it's more from that longevity lens.
Right.
Having more lean muscle, preserving strength as we age, we know has a direct correlation to like our projection as to how long we're going to live.
Right. Yeah. And how well you're going to live.
And how well you're going to live.
So low testosterone associated with cognitive decline, low testosterone associated with prostate cancer, low testosterone is associated with heart disease, right? So, I mean, you don't want to be in those categories, right?
Yeah, absolutely. So I want to shift actually and talk about younger men.
Sure.
So you did mention that there's a lot going on environmentally, and I know this is a concern for young women as well, but specifically, I want to talk about young men. I'm raising one. He's 20. He's an athlete. Obviously, testosterone is not on the table because of that. I don't think he has a production issue. But what are some of the environmental factors that we can like take control of? Like, I'm just thinking off the top of my head, I have a thing with plastic water bottles. Like everybody knows in my family, I don't like plastic water bottles. Like, is this what we're talking about? Like, so these microplastics?
Sure. Plastics, microplastics, that's an important source of xenoestrogens.
Right.
Absolutely. Yeah. So do away with the plastic drinking bottles. That's an easy thing that you can take control of.
Right.
Things like fragrances, like so people put these things in the dryer, don't put fragrance in their clothing. Yeah. So your bath towels smell great for 4 weeks. Don't be doing that.
Like those smelly beads?
Yeah, that's not really that good for you, right? But even things like carpeting, for instance, it releases certain chemicals that are exactly. So I mean, you can't avoid it all, but
what can you avoid? Like the plastic water bottles, I feel like
plastics if possible, right? And these artificial fragrances,
right?
Yeah.
Okay.
So those would be a couple things that you could try to avoid,
right?
It's present in pesticides as well. So if you can eat organic, as much as possible. There's certain foods where I think it's really important to eat organic, like strawberries. I never buy a non-organic strawberry.
Interesting.
It's the number one dirtiest, most pesticide laden thing you could eat. Yeah, exactly.
Ooh.
So get your strawberries organic. Okay.
What other things are on that list?
I'll tell you, there's the Clean 15 and the Dirty Dozen. You got to Google them.
Arden's nodding. She knows.
There you go. The Dirty Dozen, you got to avoid those, or eat organic whenever possible.
Okay, what's the Clean 5?
Clean 15.
Clean 15.
Yeah, Clean 15. So things like apples, you can wash the outside of it, right?
Okay.
So you wash your apple, you don't have to get organic apples.
Okay.
Right?
Or you can cut it. Like I just
yeah. But because the strawberries the seeds are on the outside, the pesticides just penetrate. You can wash the strawberries all you want. You can't wash it out. So
what else?
Yeah, Google them.
I know. Okay, I'll Google it. But strawberries.
Clean 15 and the Dirty Dozen. Post them on your fridge, right?
Okay.
And it'll just give you an idea of what things you should try to buy organic when possible.
And this is
just one other way to avoid some xenoestrogens.
So this is a really tangible piece of advice for
For
families
young
that are
people.
raising
Yeah.
children, boys and girls, but even like in terms of boys' hormone health, to be really conscious where we can. Obviously, we can't get organic everything, but where we can,
Where you can,
if possible. Yeah.
Sure.
No, I
Yep,
love
be a
that.
good idea.
That's awesome. I want to Google it right now.
Yeah.
So go
now,
ahead.
so when you're talking about younger men and sort of what can we do, right? We don't necessarily be wanting to put guys in their 20s and 30s on TRT, because once you're on testosterone, you're pretty much on that for the rest of your life, right?
Yes.
So if you do some injectable testosterone, what's going to happen is your own production is going to be severely curtailed.
Right.
And the testicles kind of go into hibernation, right? It's not that they could never wake up again, but it's pretty hard to wake them back up again.
Right.
So in younger men, what we would prefer to do is we would prefer to work at the level of the pituitary gland and try to reproduce those hormones, and in that way stimulate their own production of testosterone from their own testicles rather than shutting them down.
Right.
Okay. So we have some strategies that we work, with younger men on trying to utilize those pituitary hormones, either with peptides or with actual hormone prescriptions.
Okay. Tell me about the peptides.
Sure.
Can you tell me about that? I know it wasn't on our list, but I'm so curious about this because, of course, when you talk about peptides, I think about like GLP-1s and Ozempics,
right?
And that
everyone's
kind of thing.
familiar with those ones.
Yeah, and there's a
host of other molecules in that same family.
Yeah.
Right? So the ones that we use specifically for stimulating the pituitary and stimulating the testicles would be gonadorelin or kisspeptin. So what these are short chains of amino acids, typically less than 50 amino acids. They come as an injectable substance, and there'd be a certain frequency that you'd be expected to inject them. They stimulate your pituitary gland to release FSH and LH. Those are the principal hormones that would stimulate, for women, the ovaries, or for men, the testicles. FSH helps the testicles to make sperm, and LH helps the testicles to make testosterone. So we can stimulate the FSH and LH, we're going to get better production out of the testicles. So a young guy in his 30s comes to me with a testosterone of 8. We put him on a cycle like this to try and stimulate the testicles. Next thing you know, his testosterone's 28 and he feels like a rock star.
Amazing.
Yeah. And it's coming from his own production.
Right.
Now, he may take a break from that for a few months, and then if he notices performance starts to decline a little bit again, he can do another cycle.
On.
Yeah. So that's the type of thing where you could do sort of 2 or 3 cycles a year, maintain optimal production, and you don't have to do TRT for, perhaps decades.
30
right?
years.
Who knows?
Yeah. Okay. So can older men go on like a protocol like that?
Yeah. So we have some guys will come to me in their late 50s or even early 60s and they'll say, gee, I'm just not really ready to commit to testosterone yet. Right.
Yeah.
And so, okay, fine. We'll give it a try. And usually we can bump the needle a little bit and get the testosterone up. Now, is that going to be satisfactory? I don't know until we try it.
Yeah.
Some guys will have a relatively poor response at that.
Is that because they're just, everything's old?
Exactly. Things are getting old. Exactly. Right. And so, you can't get blood from a stone, but we'll try, right, to stimulate if they're not prepared to really launch into TRT. Because it is, at that stage, it's really kind of a lifelong commitment. So you're going to start TRT in your 50s or 60s. You're going to pretty much take it forever.
Mm-hmm.
You don't have to take it forever. If you decide, I just don't want to do this anymore, I just want to stop taking it.
Good.
Okay, well, yeah, exactly. Then stop taking it.
Yeah.
But what you'll find is that all of the benefits that you were accruing are quickly going to disappear, and you're going to start to get frail and weak.
Right.
Yeah.
Okay. I'm so curious about the elderly clients that you have that are in their 60s, maybe, or older, that are doing good. What are they doing? The ones that maybe don't have this, a depletion of testosterone, are still within that relatively normal range. What is their secret?
Yeah, the guys in their 60s that are maintaining good levels of
they're not riding bikes or
they're generally quite fit. Yes.
Yeah, okay.
So they're the guys that are out cross country skiing and they're lifting weights in the gym and they've just had an active, fit, healthy lifestyle.
For their whole life.
Yeah, for their whole life, and they're usually relatively close to their optimal body weight. Have managed their stress and so
Sleep.
on. So yeah, exactly. So sleeping well, keeping their stress under control and keeping fit. So the people that have made an investment in their health with appropriate lifestyle choices in their 40s and 50s, they're going to age better, right?
Right.
And so those are the kind of the success stories. But, we're there to help if and when the testosterone production starts to flag off.
So interesting. So like we're talking now a little bit more about prevention, or like we just know more, the research is coming out. We just know more. So what are some, like, as you said, like what if you're in your 30s and 40s and you're listening to this right now and your testosterone levels are probably decent.
Okay, half decent.
Yeah, exactly. What would you recommend as a, physician and somebody that specializes in this, like lifestyle activities or practices that would help to promote healthy hormonal aging? Right.
Yeah.
So or is that even possible?
That's an excellent. No, it absolutely is possible, and these things are within your control.
Yeah.
And you don't have to take a prescription. Okay.
Right.
So the key pillars, there's really 4 key things that we focus in on. Okay. So number 1, put healthy things in your pantry and in your shopping buggy. If you put crap in your shopping buggy, somebody might eat it, right? So if it ends up in your house, it's a temptation. So just don't put crap in your shopping buggy. Okay. Number 2 is get some regular, vigorous physical activity. Okay. So I don't care really what it is, but some of it should be lifting heavy things.
Right.
Whatever that looks like. Okay. So you can't just do aerobic stuff all the time. That's not good enough.
Right.
You got to lift heavy things. Okay.
Right.
So find a blend, and we can coach you on how to do appropriate exercise. The third thing is reduce your stress. Okay. So whatever that takes, you take a little mini vacation for 2 minutes at lunch hour, close your door, close your eyes, take a few deep breaths. If you did that for 2 minutes, you would reduce your cortisol, reduce your stress, reduce your blood pressure. It's all you need, like a little 2-minute break to just do some deep breathing.
To recalibrate.
Okay? End of the day, go for a walk, get some fresh air, or, whatever it is for you, sit on a park bench and read a book for 20 minutes. Like just a little mini vacation, just a little time of refreshing, put your stress behind you, focus on something else. Okay. And then the final pillar is you got to get a good night's sleep. Right. That's where all the repair and the healing happens. So you got to set yourself up for a good night's sleep. That involves good sleep hygiene. Shut the screens off half an hour before you're going to bed. Make sure the room is dark and cool and appropriate, and all that stuff with no distractions. Don't have your cell phone at your bedside, right?
Right.
So those are really the pillars, and those are things that are within people's control. So the thing is, if you start to cultivate those good habits in your 30s, 40s, you're making an investment in your future health.
Yeah.
You're putting money aside in your RSP. Well, you'd like to be able to live and be healthy enough to enjoy it. Well, let's put some energy and some investment into our future health, right? So those are all things that are within our control.
Totally. And I mean, even if you're not in your 30s and 40s anymore, and maybe in your 50s and 60s and
it's
70s,
never too late.
It's
never too late. Exactly. Like, so if you've eaten crap all your life and you're sitting on the couch watching TV all the time, like, get up off the couch, go for a little walk, and get rid of the chips and the crap from your pantry. Like, just doing that alone would make a good investment. So it's never too late to start some healthy habits.
Yeah. I think that's great advice. And as much as we love to talk about some of these interventions, at the end of the day, there's always things that you can do to empower yourself to live a more, we call it, wealthy lifestyle. And that's like from a holistic perspective.
Right.
You talked about, sleep and stress, which we know is like a huge catalyst for disease. Just simple things like 2 minutes.
Yeah.
At lunchtime.
That's all it takes. 2 minutes, some deep breathing, right?
Yeah. It's amazing. Okay. So I want to talk about your work in longevity medicine. Is that what you call it?
Yeah. Anti-aging.
Anti-aging.
Yeah,
okay.
Yeah.
So we're not talking about fillers and Botox. We are talking about something way different. Can you share with me and our audience a little bit about your research?
Sure. Yeah. So we've got a few different research projects on the go right now. One involves the bioidentical hormones. So one of the things about bioidenticals is that often these things will be compounded by your local compounding pharmacy.
Okay.
So
that means like mixed
That means
together.
they actually mix it up. They have a little lab in the back, right?
Yeah.
And they put the little powder in with the cream and they mix it all up and they put in a little pump for you, and they've actually manufactured it at the pharmacy.
Yes.
That's quite different from a normal pharmaceutical that comes comes from a factory, from who knows
and
where.
it's like mass produced.
Yeah. And it's got a DIN number, and it comes from a drug manufacturer. So we're doing some research to compare the equivalency of the outcomes of these kinds of things. So for instance, for a woman on estrogen, we could give them a bioidentical estrogen patch that comes from a drug company, or we could give them a cream in a pump that's made by the local pharmacy. So we have patients that prefer either. And so we like to kind of compare and see how they're doing. Can we get equivalent results and symptom control using bioidentical, and compare that to what we're getting out of the pharmaceutical. So that's one aspect of the research that we're doing.
And what would be the benefit of that?
Well, the
like
idea
more
is
tailored?
we want to be able to accumulate some data about the efficacy of these bioidenticals,
Right.
because the if you're not measuring it, then how do you know really
Right.
what the outcome is? So the key thing really is providing some data that supports the use of these things as being as good as the pharmaceutical alternatives, right? And then that data actually becomes worth something, because the companies that are behind the bioidenticals, putting these creams and little dispensers and so on together, they have kind of a vested interest in being able to prove that what they are providing is going to provide some clinical benefits, right? So this data actually has a monetary value. So that's kind of a cool aspect of one of the things we're doing.
Very interesting.
A second thing that we've just launched is the Canadian Peptide Research Society. So we're researching outcomes of various peptides, and you and I just briefly touched on that. That's a topic for another day.
Oh my gosh, but it's going to happen because I love that. It's
huge
so
area.
interesting.
So we right now have 3 data tracking circles that we're using peptides for. One is for musculoskeletal health, the second one is for gut health, and the third one is for cognitive health. So we register people in this sort of data tracking tool at the outset. Then they do a series of experimental peptides, and we track the outcome at 1 month, 3 months, 6 months to sort of see how they're doing symptomatically.
I'm just gonna okay, I know it's a topic for another day, but it's something that I have just come across and I find it fascinating. Peptides are not I learned it in relation to the Ozempics and they're not drugs.
Right. So if they're small enough, they can actually be qualified as a food supplement.
Right.
So these bioregulator peptides that are a few amino acids long, they're just an oral capsule. It's sold as a supplement.
Right.
So there's no sort of importation rules across the border. I've ordered these bioregulatory peptides and taken them myself, and
right.
I get them out of the US, and they're just marketed as a food supplement.
It's just interesting because I feel like this is kind of an emerging area.
Maybe
Absolutely
it is. It's just kind of in its infancy, I think.
Yeah.
And so I think that's kind of a really cool area of development. So we want to do it properly, right? So when we register a patient for a peptide program, they give an informed consent. They understand that it's experimental in nature. There's no proof of the outcomes yet, and we don't have a lot of human safety data, right? So they understand that they're taking this on an experimental basis.
Yeah.
And then we track their outcomes. Okay. So that qualifies as research. And then the third part of my research, which I'm really passionate about, is stem cells.
Yes.
So I have this project that's been approved by Health Canada to use stem cells for osteoarthritis. And it's one of the only projects of its kind in Canada. So it's really very exciting. I'm treating all the peripheral joints, shoulders, elbows, wrists, hips, knees, and ankles. And so we're that's quite an exciting project.
I know. And and you are on the leading edge
pioneer,
of this.
Pioneer in Canada. Yeah.
So I'm going to double click on that one too.
Yeah.
What are you doing? Where is the stem cell? When I think stem cell, I for some reason think spinal tap and pulling it out and then putting it back in somewhere else.
So
tell me I'm wrong, or
we take the stem cells from 2 areas in the body, okay? Either from your fat or from your bone marrow. So in my research project, I'm going to enroll 240 subjects. I just enrolled subject 149 this week, and tomorrow I'm going to do subject 150 out of 240. And what happens is the subjects get randomized into one of 3 groups. The first group is going to get stem cells from fat. Second group gets stem cells from bone marrow. Third group gets both. So our hypothesis is we think it's possible that the group that gets both might do better than either of the others that only just get one source of stem cells. All right. Now, so far, it hasn't turned out that way. Each of the groups is doing equally well. So, we haven't really been able to discern a difference yet. So we're actually looking at applying to extend the trial and enroll another 120s for a total of 360, hoping by that time, maybe if the difference is going to emerge, it might emerge by then. So
fascinating.
Yeah.
And what are you looking for? Like, when you say they're doing well, what does that mean?
So there's two outcome measures for how they're doing. One is a pain score on a scale of 1 to 10. So they just put a little X on the, just pain in the affected joint. How bad is it on a scale of 1 to 10? To be a clinical meaningful improvement, we want to see the pain score drop by 2 points or greater. If it drops by 2 points or greater, we consider that to be meaningful. Okay. And the second tool that we use is a function questionnaire. How are you doing and how does it impact your life? And can you do your usual recreational activities? Can you do your household chores? How is it for getting up and down stairs and different things like that? Yeah. So a 12-question function questionnaire. And that score has to improve by 4 points or more to be clinically meaningful.
Interesting.
Okay? So that's the other aspect of our research.
And so this, circling back to the bigger conversation around longevity and anti-aging, the idea is not just to turn back the clock, but to optimize. I always think, okay, so full disclosure, I'm a yoga person. I like to stretch and bend. I don't like lifting heavy things.
Yes.
But I know it's really good for me.
Yeah.
To maintain or grow my lean body mass.
Right.
But the reason for that is so that I can do all the things, like eventually in my 60s, 70s, and 80s, I can, lift things up. I can move things around. I can throw my grandchildren in the air. And if I fall down, I can get up.
Get yourself up.
Right? Yeah.
Right.
And so that's kind of what you're looking at optimizing for people. Joint pain is such a huge, we hear about it all the time, right? Mm-hmm. Such a limiting condition.
Problem,
yeah, totally. Yeah. So if there's a way that we can crack that one, it really just extends people's quality of life.
Absolutely.
Yeah. And that's the anti-aging longevity piece.
Sure.
Right. You're not going to turn back the clock and make the joint.
It's not going to be perfect.
Younger.
Right. But if we can prolong the life of it and keep you more comfortable along the way, that's the goal. Yeah. So aside from the stem cells, we can also use PRP, which is platelet-rich plasma. We can combine that with some of the musculoskeletal peptides. Sometimes we combine it with a substance called hyaluronic acid. So we have a number of different ways of treating joint pain. Mm-hmm. Outside of research.
Okay. Oh my gosh. I'm so going off script right now. I'm sorry because we prepared. You have all your notes and now I'm just like, but what about this? And what about that? So basically, like what I'm curious about, like when it comes to your work, especially you, because you are kind of unique. Like you have a background in traditional medicine, but what you're talking about is functional medicine, which is different, right?
It is different, yeah.
Like can you maybe just pull apart, what's the difference?
Yeah, so the idea is, traditional medicine will very much kind of be like a knee-jerk approach. A person comes in with a certain number of symptoms, we do some tests to figure out the diagnosis, we prescribe a treatment, off they go. And so it's a little bit of a superficial interaction because it's very problem-oriented, right? Functional medicine takes a little bit more comprehensive approach, right? So, the intake assessment involves assessments of all different aspects of your function. How's your marriage going and how's your work and, how's your sleep and, all of those kind of things. So what we're trying to do is we're trying to get at root causes. And we're also kind of trying to tie things together because oftentimes, one aspect of your health will be adversely affected by something else going on in a different department. And, sometimes it's difficult to kind of put those two things together, right? What really is the root cause? Mm-hmm. So a little bit more detective work, a little bit lengthier appointments, and certainly quite a bit broader laboratory investigations. So some of the investigations, for instance, are not covered by your public insurance, your MSP. So I always give patients 2 blood slips. They have to go to the lab with 2 slips. And the lab tech is like, why did your doctor give you 2 slips? Well, it's because some of the stuff is just not covered. And I want to know that. So the patient has to pay something for these non-insured tests. And then we can get a more comprehensive look at what exactly is going on. So I think it's just a little bit more comprehensive. And it tries to tie together all of the aspects of your function. That's why it's called functional medicine, to try and get you functioning optimally.
Right.
Is the idea, not just managing a disease.
Right. My bias is showing, but I love that in the sense that, sometimes it is things that are happening in your life that are contributing. You said,
Absolutely,
like, how are your relationships? How's your connection to community? Like all of these things we talk about on this podcast. It's, we call it the Wealthy Podcast because there's so many aspects of our health that make up how we feel and how we feel in our bodies and how we feel mentally and emotionally and all of that. And they are connected. We're learning more and more that they are connected. Again, I know it's off script, but like, I'm so curious. Given the situation that we're facing in healthcare right now, universal healthcare and some of the challenges, where do you sort of find hope? Or do you just sort of go, well, it is what it is, and like, I'm going to hoe my own row?
Yeah. Well, I'm encouraged that more of my colleagues are prepared to kind of make the move into the kind of work that I'm doing, taking a more holistic view and moving towards functional medicine. Because I do see a little bit of a kind of a groundswell of support for that. And certainly there's a big demand for that in the population because, the average person is recognizing, the limitations of healthcare. If they've had any interactions with the public system, they know that there's long waits and that it's very disease oriented. And, the folks that will come to me for advice in the anti-aging arena are people that are prepared to actually make a bit of an investment. So they're prepared to step outside the public health system and pay something for some medical advice. And then if I produce a list of recommendations, they're actually much more compliant with the list of recommendations because they've actually got some skin in the game.
Totally.
They actually had to pay for my advice. So they're going to listen to every word and they're going to try and make a point of doing most of the things that I recommend, right? So it's super satisfying as a provider, and it's also very satisfying for the patient because they've got all these great recommendations from this doctor, And so so more of my colleagues are coming on board with this kind of approach. And I know a couple of folks in the community that sort of have a foot in both camps. They do a little bit of the publicly funded, but then on the side they're also doing some consulting. And I know one other of my colleagues in the community that's given up family practice to just focus exclusively on this. Right. And so it's starting to become more of a popular option for providers because, it always used to be this sort of sacred cow in Canada that healthcare is publicly funded and you shouldn't step off that treadmill, and I'm very satisfied with where I am in my career right now. I love what I'm doing. I'm passionate about it. And I love interacting with my patients. It's not a drudgery to go to work. It's exciting, right? And so there's definitely an appeal to doing this kind of work for sure.
And I can only imagine how satisfying it must be for you, both personally and professionally, to have that, like that relationship with your patients where you get to see the outcome. Like, I don't think that sometimes our healthcare practitioners get to follow their patients along the way that you might, just because of the way that the model is set up, not because they don't want to, but because it's just not the way the model works, right? Whereas you have that kind of like long-term relational aspect to it where like their win is your win.
Absolutely.
And you get to see like the impact that you're having on people's lives in like there's data and metrics to support that.
Yeah. And because we're doing regular, quarterly follow-ups on folks, regardless of which sort of stream they're in, we do get that feedback, right? And we track their progress over time. So it's really very satisfying.
Yeah. Amazing. Yeah. Okay. We're running out of time. Definitely going to have you back because I have 8,000 questions I didn't get to. But I kind of want to shift gears a little bit
Mhm.
and get to kind of a little bit more philosophical questions. If you think back to Grant from, high school, or even your early days in university studying biology or medicine or what have you, how do you think your definition of health and what constitutes health care has changed over the years?
Yeah, I mean, my first exposure was, full service family practice and emergency medicine, right? And so my initial approach was, I'm faced with a problem. How am I going to come up with a solution? And I guess, just by virtue of the training, you tend to sort of compartmentalize these things. So you think of this as this is a particular problem. In the emergency room, I have a gallbladder in bed 1, I have a heart attack in bed 2, and so you sort of think of the individual as just the disease,
Yeah.
right? And so really it's been in the last, 15 to 20 years in my career that's kind of shifted, and I've looked more at the holistic approach, right? So my practice really took a turn in about 2008 when I was hired on as the medical director for a facility called iQuest. It was this really cool concept here in Kelowna. There was one in Vancouver and one in Kelowna, and it was this multidisciplinary sort of team concept where you had kind of subscription membership of people that would come to be able to access healthcare. They would have fitness instructors, kinesiologists, physio, sports medicine, a naturopath, and I was the medical director.
Right.
We had nutritionists, we had
like a one-stop hub.
kind of a one-stop
Yeah.
sort of a health membership club where you could have your healthcare and your sort of wellness care. So nutrition advice and exercise and all this kind of stuff. So being part of that kind of a program was really kind of eye-opening, and that sort of revolutionized, I think, my approach to healthcare and kind of tipped me into the sort of functional camp and the holistic camp.
Yeah.
And it's quite interesting actually how I got started with the bioidentical hormones, because the owner of that iQuest clinic came to me on a Friday afternoon and he said, Grant, I think we're going to start doing a bioidentical hormone replacement program. And I said, oh, what's that, right? And he said, well, I've been reading a little bit about it. Here's a book, and maybe you want to, just kind of do a little reading on it and think about it. And I said, well, how soon would you like to roll out this program? And he said, Monday. So I pounded through this book on the weekend, and I didn't know what I was doing. I'm phoning the compounding pharmacy every day. This woman has these symptoms. What do you think I should start with? And the pharmacists were great.
Yes,
a couple of local
as
pharmacies
they
are really
yes.
good with the compounding. And so, they gave me a lot of advice and held my hand as I was kind of initiating these sort of prescriptions and getting things off the ground. And of course, I went to more courses and got board certified in anti-aging medicine. So, but that was kind of the impetus to moving me in this direction was, we're going to roll out the program on Monday. Okay.
There's a stark contrast to how it works in like the universal healthcare system.
Exactly.
We're going to roll it out over the next 16 years.
Right, yeah. So,
no shade. We get it. That is awesome. And really, it's so interesting because, we've had physicians from almost every medical specialty that I can convince to get into that chair, and they're all sort of coming around to the same conclusion that health is just so much more than just being disease free or injury free, right? It's just it has to be from a holistic lens if we're going to talk about health, right? Okay, so what areas of your health life do you feel that you are wealthy in the way that we define wealthy here on the Wealthy Podcast, which is that holistic approach, that perspective,
sure.
all the areas of health and care that combine? What areas, like what is Grant wealthy in?
So the top one I would say is relationships. I'm in a fantastic marriage with a wonderful woman. I'm in a close relationship with my kids. I've got these couple of grandkids now. And so I'd say, relationships are wonderful. I've got, a couple of close groups of male friends as well that I do stuff with. I have a group that I cycle with. I have a book club that I get together with, and I play in a band. So,
Nice.
so I've got some social circles and so I'd say really rich in relationships. The second thing is spiritual health. So that's something we haven't really touched on, but I think that's an also important dimension. And I often bring that up with my patients, how are you doing spiritually? And they're like, what? But I think that's important as well. So I'm connected with a wonderful church here, the Metro community. So we work with the homeless and the drug addicted. And so it's very practical sort of thing. So that's really an important thing for me as well, is my spiritual health.
And what does how does that contribute to
well-being? Here's one simple way that it contributes. The very first thing that I do in the morning when I get up is I sit in my comfy chair and I read a devotional material for about 20 minutes to half an hour. That's how I start my day. And that just equips me for the day, gives me peace, sort of helps me to, just kind of, be sort of centered, focused, and ready to go. Then I turn on my phone, check my emails or whatever else I got to do, my other tasks. But I kind of set my frame of mind with that little quiet time, 20 to 30 minutes every morning, just my little meditation time, right?
Mm-hmm.
So, so I think just kind of being spiritually aware and setting aside, a certain amount of time just to kind of reflect and then you're intentional about your day, right?
Mm-hmm. I love that you bring that up. It's an area of healthcare that I'm really passionate about, but it's a hard one to talk about in the context of kind of like the medical system, right?
Yeah, exactly.
But I always really appreciate when we have people like yourself include that as a huge part of overall health.
I think it's an important thing.
I
sure.
definitely,
and it's something that's neglected. And then a couple of other areas, I'm quite disciplined with my fitness. So I have a personal trainer. I go 2 days a week. I do upper body one day, lower body the other day. I'm not a weightlifter, never have been. But I just feel that at this stage of my life, to preserve muscle and bone, and if I have a trainer kicking my butt, I'll perform, right? I just wouldn't do it quite the same on my own.
Yeah.
And then I enjoy a wide variety of other activities. I'm water skiing and I'm cross country skiing and I'm riding my bicycle and playing
being
pickleball
outside
and all those kind of things. Yeah, I love activity, right?
Yeah.
So I have a bit of a structure in terms of how I do that. And then I try to eat healthy, right? So those are sort of the things that I think that I'm doing well at, and that I would consider myself wealthy in those areas.
You're walking the talk.
Well, exactly.
Those are your pillars.
That's right. And that's exactly what I tell, my patients, right? Is that, I try to exemplify what I'm telling them to do. Right.
Mm-hmm. Well, and then you can speak like confidently about like,
right.
I know this because
and I've got some personal
this.
experience in this, and this is how I do it. Right. So not that you have to do it exactly the same as me, but I know what works.
That's amazing.
Yeah.
So we've spent quite a bit of time today talking about all sorts of topics, but primarily about men's health. And I think I'm going to ask you last question. If there's one piece of advice, one nugget of inspiration, anything that you would like to leave with our audience, particularly as it relates to men's health, because you're the guy, what would it be?
Well, I think really that what you need to do is you need to take charge of your health. Okay. There's lots of things that are within your control. And we touched on some of those things that you need to be mindful about, and that those things can have a big impact on your health outcomes. If you need additional help, find a coach. Find a medical provider that's knowledgeable on how to optimize hormones, right? You can follow us at Pagdin Health on our social media and Facebook and so on, right? For health tips, be part of the email list, if you want some additional help with health, but take charge of it, right? Mm-hmm. Make some healthy choices.
I am obsessed with agency. I love that you said that, because I think that that's one thing that sometimes gets overlooked, is like, nobody's going to do it for you. No one is going to, not even your wife or your partner or your kid. Like, it has to be, you have to make that decision yourself. And once you make that decision to like really commit to your own health journey, nothing can stand in your way.
Absolutely.
Yeah. Amazing. Thank you so much, Grant.
Oh, you're welcome. It's great to be here.
A super quick hour with you. I appreciate all the insight. And And keep doing what you're doing for the men in our community and the women, because I know you have women clients too.
Thanks very much. Yeah.
Thank
Appreciate
you.
that. Thanks.